Hello, my name is Patricia and I'm a physio within the Pelvic Health team here in the Southern Trust. During the time that you've been pregnant and through the labour process, your body will have underwent major changes. And as a result of these changes, we would advise that within the first 6 weeks postnatally, the focus would be on rest, recovery and recuperation, whether you've had a vaginal delivery or an abdominal delivery. While this video will focus on your physical recovery, we are mindful of your mental health at this time. Following delivery of your baby, there will be dramatic changes in your hormone levels. And as a result of this, you may feel teary and emotional, particularly in the first few days postnatally. If this was to last for greater than 2 weeks, we would advise that you would ask your GP or midwife for some support. In the first few days, rest is key. Saying that, we still want you to move little and often. When you are resting, lie down on your back or on your side to minimise pressure on your healing abdomen and your healing perineum. Use pillows between your legs, underneath your bump, or in and around your back. Take your pain relief as prescribed. Following a vaginal or an abdominal birth, you may experience some pain, but it's important to keep that pain manageable so that you can function. If you feel the pain is increasing or is accompanied by any redness or oozing, it's really important that you talk to your GP or midwife immediately. Start gentle and rhythmic tightening and relaxation of your pelvic floor muscles. This will help for you to reconnect with your pelvic floor muscles and also aid with healing and ease discomfort in and around the perineum, that area between your back passage and your vagina. It's important to be working your pelvic floor muscles right from the start. We would advise you to think about trying to stop wind and trying to stop pee. So you're drawing up from the back passage and working your way forward. You should feel a squeeze and a lift when you do this properly. Some women may suffer from incontinence during their pregnancy and particularly in the first few days and weeks postnatally, but this should improve with time and rehab. I'll now pass you on to Paula, another member of our pelvic health team here in the Southern Trust, who will speak a wee bit more about good bladder habits in the first few weeks postnatally and a wee bit more detail then on those pelvic floor exercises.
So no matter what type of delivery you had, whether that be vaginal or abdominal, it's always good to start with good bladder habits. Things that are important is it's good to not just go to the toilet just in case, and you really want to, when you feel that need to go to the toilet as well, always not go straight away. Other good habits that are important is try not to hover. When you are going to the toilet, make sure you're sitting down and that encourages you to empty fully. Another thing we tell patients to avoid is to avoid trying to stop your flow of pee. Other important things as well is not to push and strain as well when you are trying to empty the bladder. Another problem that people can describe is that when they finish going to the toilet, that they can feel leaking after. What we do tend to talk about then is the double void, and that we encourage patients when they're on the toilet is to lean forward, as far forward as they can go, and then lean back, and this can help further empty. We would also promote really nice big deep breathing and relaxation to encourage that bladder to empty. Often we see a lot of patients that maybe limit their fluid, and we often don't promote this. We encourage patients to drink regularly and aim for straw-like urine. When we do limit our fluids, sometimes that can cause our bladder and the urine to be very concentrated, which again will irritate the bladder further. When we're talking about bladder irritants, we often say to our patients to limit or reduce fizzy drinks, high caffeine drinks, energy drinks, and even artificial sweeteners. If you are finding that you're having any problems going to the toilet, do discuss this urgently with your GP or your midwife. So now we're going to talk a wee bit more about our pelvic floor. Patricia's already touched on this, but we want to know the importance of why we do these. Your pelvic floor are really important to help support your pelvic organs. They wrap around your bladder and your bowel to help keep you continent. They also help support your pelvic muscles and bones. And fourthly, they usually help with sexual function as well. So when we're talking about our pelvic floor, we're starting to feel that contraction a wee bit more, that squeeze and lift, that backwards to forwards. It is important to try and get more into a more structured regime. So we split this up into two. We talk about our quick contractions where we tighten up and we let go straight away. And then we talk about our slower contractions where we tighten up and we hold, and we aim to hold these for 10 seconds. Usually then we would highly recommend a 4-second rest before you try to squeeze again. It can only take a wee bit of time, and that's okay to build that up gradually. We usually would aim for 10 quick, fast contractions and then 10 slow 10-second contractions, and we're aiming for those 3 times a day. What can be quite helpful to help you remember about this is tying it in with baby's feeds, but also the NHS has created a really useful app called the Squeezy app, which can be downloaded to your phone to help remind you. Once you feel happier and that things are going well with your pelvic floor and you can feel that lovely squeeze and lift back to front, we would say to try these in different positions. So if you try them in sitting and lying, we'd encourage you to do them maybe in standing up, or maybe functional activities like sit to stand. But this can really take 3 to 5 months for you to really feel like your pelvic floor is stronger and making improvements. Another technique we regularly talk about is the knack. And the knack is a conscious technique where you tighten up back to front before you do an activity that you're worried maybe about leaking or feeling like you need more support. What this does is you're consciously telling your pelvic floor to give you that support of that downward pressure that you can feel, maybe lifting, maybe coughing and sneezing. So the knack technique is something that you will have to consciously do the first few months, but this may become a more natural contraction as time goes on. This squeeze and lift is not something you hold for very long. It's a matter of 2 to 3 seconds to help give your pelvic floor that support. So it is important, like with all pelvic floor technique, that you don't hold your breath. You're trying to breathe naturally. You're not clenching your bum cheeks or squeezing your legs to do this.
Hello, my name's Wendy, Pelvic Health Physiotherapist, and I just want to talk now about bowel habits after delivery. We want to give you a few tips on how best to manage your bowel habits. First of all, ensure your fluid intake is sufficient to include water, fruit juice, milk, and moderate levels of tea and coffee. Ensure especially you have good fluid levels if you're breastfeeding your baby. Your diet should include and consist of cereal such as porridge, bran flakes, Weetabix, and try and eat fruit and vegetables including pulses and nuts as well. It's essential to try and minimise the possibility of constipation. Passing a firm bowel motion in the early days postnatally can be painful, so aim for a softer motion. And you may also be advised on medication by your GP or your midwife to help or assist with this. If you've had a perineal tear or an episiotomy, it may be uncomfortable to pass a bowel motion in the immediate few days after delivery. You may also find this to be the case after Caesarean section. Take your time when you're emptying your bowel. Sit fully on your toilet seat and don't hover, because that increases tension in the pelvic floor. Ideally, if you have a low stool, just maybe 8 to 10 inches high, place that in front of the toilet with your feet firmly set on top of it. Your arms should be resting comfortably on your thighs. You don't want to sit in a hunched over position, but have your back quite straight and just looking straight in front of you. Keep your tummy nice and relaxed. Tummy breathing encourages relaxation of your pelvic floor, so just breathing in and out nice and gently with an open mouth. But you may also find in that immediate postnatal period that you have to support your tummy or support your perineum whenever you're passing a bowel motion, and that's quite normal. Try short walks and build these up gradually, because exercise is all very good to facilitate good bowel activity.
Hello, I'd like to talk to you about recovery after a Caesarean section. So a Caesarean section is a surgical incision made through the mother's abdomen and uterus to deliver baby. It will take a minimum of 6 weeks for basic tissue healing to happen and up to 12 weeks for full healing. So looking for signs of infection would include signs such as redness, heat, increased pain, any discharge or pus from the area or any smell from the area. Also keeping an eye on how you're feeling yourself, any temperatures or generally feeling unwell. If any of this was to be the case, please contact your GP or your midwife as quickly as you can and request a review. It's important that we're continuing to take deep breaths to ensure that we're using our lungs efficiently and prevent any chest infection post-operatively. This also has the added benefit of starting to gently mobilise the tissues in and around your scar. So what we mean by that is taking some time out through the day and trying to practice relaxed breathing, or tummy breathing as we would call it. So placing one hand onto your chest and one hand onto your tummy, nice and low down onto your tummy. What we want to try to start to do is bring the focus down onto that bottom hand. So trying to relax the shoulders and minimise movement from this top hand. So as we breathe in, our tummy should be gently coming up. So it's breathing in, tummy coming up, and as we breathe out, the tummy will just gently fall back down again. So it's breathing in, tummy coming up, and gently falling as you breathe out, with minimal movement here at the top hand. So a nice wee tip is to keep a small pillow or a cushion or a towel close by to give you that support whenever you know that you need to do a cough. So if you know you're about to cough, it would be to get a pillow, place it around your scar nice and close, and give yourself a good hug in. Then gently bend over and do one good strong cough to clear what you have to clear from your chest. It is recommended not to be lifting anything heavy within those first 6 weeks after having baby, after a Caesarean section, or any kind of heavy housework. We are mindful that you have a newborn and there will be a certain amount of activity with the newborn, so we would recommend not lifting anything heavier than the weight of your baby. Whenever you are doing an activity such as childcare activities and lifting your baby, we would encourage you to try to give your tummy a wee bit of support while you do this. So that is gently drawing in your lower tummy muscles while you do the activity such as a lift.
It is important to do the everyday activities well while your body is recovering. When turning in bed, use your hand to support your tummy, and with your knees bent up comfortably, roll to your side, moving your shoulders and knees at the same time. From the side lying position, continue to support your tummy, while using the other hand to push yourself up to the sitting position, dropping the legs over the side of the bed. Sit for a moment before standing up, using your hands for support. On the way back down, do the reverse, ensuring you lift your legs in the bent position as you lower your head to the pillow at the same time.
Hi, I'm Shannon. I'm here to speak to you about regaining physical activity after pregnancy. Patricia has talked about the early days after pregnancy and how rest is important, but when you start to feel like you're ready to do a little bit more, I've got some advice for you then. Getting started with some gentle activity and exercise can help with your mood, your energy levels, and avoiding further complications. A good place to get started with your recovery and return to exercise is the POGP Fit for Future leaflet. We'll add a link at the end of the video. I'm going to demonstrate some of the exercises in the leaflet now.
The deepest abdominal muscles are called transverse abdominals. Find your neutral spine, that's neither too tucked or too arched, just in the middle. Find your hip bones and move your fingers 2 centimeters down and 2 centimeters in, and you'll be now on your deep abdominal muscles. Breathe in, gently allowing your tummy to rise. As you let the breath out, keep your back and ribs relaxed while drawing in your lower tummy at the belly button towards the spine. You will probably feel the muscles under your fingers tense up. Other basic abdominal exercises are the pelvic tilt. So do a basic abdominal contraction as previously shown, drawing up your pelvic floor muscles at the same time, and then flatten your lower back into the floor or bed, allowing your pelvis to tilt. Breathe normally and hold this position for 3 seconds and release gently. Repeat this up to 10 times, 3 times per day. Another exercise is knee rolls. So again, do a basic abdominal contraction as previously shown, keeping your back still on the bed and your knees and feet together. Slowly let both knees go to one side. Bring them back to the middle. A further exercise is the one leg stretch. Again, do a basic abdominal contraction, switching on those deep tummy muscles, drawing up your pelvic floor muscles at the same time, and then gently slide one heel away from you, keeping the heel in contact with the bed or the floor the whole time. So to progress your exercises, you can move on to alternate knee bends. Bend your hip and float your knee up as far as is comfortable. Hold for a short count and then lower your foot to the floor with the abdominal muscles staying active throughout. Do not hold your breath, and then repeat on the other leg. Bridging. Do a basic abdominal contraction and draw up your pelvic floor muscles. Start in a lying position on the floor or on a firm bed, and very gently curl the pelvis inwards, starting from the tailbone, and bit by bit roll your spine away from the floor to create a bridge above the floor. Imagine that you are lying on a strip of Velcro, peeling yourself away from it, and then gently roll back to the starting position.
These exercises will help to reconnect with your tummy muscles that have lengthened and expanded through your pregnancy as baby has grown. Most women will develop a degree of separation of their tummy muscles as a result of pregnancy. This is known as diastasis or as diastasis recti, and most will recover naturally with time and rehab.
Another good resource for return to activity are the return to running guidelines. Although they're entitled Return to Running, they're a good guideline for any return to activity postnatally, especially in the early stages. From weeks 0 to 2, you can consider starting your pelvic floor muscle strength and endurance exercises, starting with basic core exercises as demonstrated, and some gentle walking for cardiovascular exercise. From weeks 2 to 4, progress your walking, progress your pelvic floor exercises, and your core rehab as you're able. You can introduce some squats and lunges, and from weeks 4 to 6, you can consider different types of low impact exercise. You can up your walking slightly, you can try static bikes, or you can try other exercises like cross trainers. For all of these exercises, be sure to listen to your body, take your time, and only do what you're ready for.
Thank you for watching our postnatal recovery video. Seeing improvements in your urinary or fecal leakage can take time. However, we would advise if you're not seeing improvements to seek a pelvic health referral. Other issues to seek a pelvic health referral for are bladder urgency or frequency, pelvic girdle pain that is not improving, pain or leakage during intercourse, diastasis recti, and finally heaviness, pressure, bulging or dragging in the pelvic area. These concerns can be reviewed or discussed with your GP or midwife, and they can refer you onto a pelvic health physio to be assessed. Again, thanks for watching, and the pelvic health physios in the Southern Trust hope you find this advice beneficial in your postnatal recovery.